Hello and welcome to Prescribe Orly. It's your host, Shatner.
I'm Chris.
Today we're going to be discussing about... What are we discussing about, Chris?
Arthritis.
First of all, Chris, I must ask you a question.
It's a
look, isn't it?
someone watched too much Pedro Pascal while they were on holiday, and now they're trying to. Yeah, no,
Yeah.
It looks good. Yeah.
Yeah, but...
what does Alex think of it?
let's not...
Oh, okay.
So, yeah, let's discuss about
Arthritis.
rheumatology.
Yeah, well,
We're gonna-
arthritis. We're gonna sort of have a two episode series on.
Well, we'll see how much we cover.
We'll see. We'll see how fast it goes.
Yes, so we are going to start with osteoarthritis, and we will be discussing about what it is,
Yeah.
what it does,
Yeah.
the treatment, and also the...
Signs, symptoms, the whole shebang.
The whole
9
shebang.
yards. Okay.
yeah, that's
Osteoarthritis, right?
let's
So it is an irreversible degenerative disorder that results in the breakdown of articular cartilage in synovial joints. Okay.
aka Highland,
Yeah.
for all those, what do you call it, pathology people out there.
Aye, they know all those wee bits.
Yeah.
We are not those people. We are not smart enough for
But
that.
just putting it out there.
Yeah.
So
Yeah, mainly affects your sort of big weight bearing joints, so
Yeah.
knees and hips.
yeah,
Um,
and it leads to painless loss of function.
Yes.
Yeah, so the sort of primary causes can be idiopathic or generalized, which the generalized side of it comes from a genetic component that encodes the genes for hyaline gags. And you might be wondering what gags is. Chris, do you want to explain?
Glycosaminoglycans, I believe.
Damn right.
Pronunciation, isn't my strong suit. But yeah, I just learned gags.
Gags.
Yeah.
So, and those are the two primary causes usually.
Yeah, so you have your idiopathic or generalized,
Yeah.
and then you have your secondary causes, which are your trauma or infection or actual sort of childhood disorders, like your
Is that your DDH?
yeah DDH and SUFI. So
Yeah.
developmental dysplasia of the hip is DDH, and SUFI is the slipped upper femoris epiphysis. Once we start doing ped stuff, that'll be
That'll come in.
Yeah,
Yeah.
that'll come in at a certain point.
And don't forget Perthes.
And
Perth.
Perth, which is like
Sounds like I have a partial tongue.
Yeah,
And
Alright.
crystal depositions
Yeah.
and previous history of any sort of inflammatory conditions can also predispose you to having
Your
osteoarthritis. So
yeah.
like the sense of
If-
rheumatoid arthritis.
Yeah, if you've had that, in your sort of 30s, 40s, then, once you get a little bit older, it's gonna, rear its head as osteoarthritis in your bigger joints.
Yeah.
And then we also have your metabolic causes, so your hemochromatosis and your hyperparathyroidism.
Yeah.
And then your neuropathic causes like Charcot's arthropathy.
Not to confuse with Charcot's triad,
Yes.
because that's happened before.
Yeah. But yeah, so moving on to your signs and symptoms. So you will always have the localized disease.
Yeah.
You'll have pain in your knee or hips, which will typically be on movement, especially after rest, and made worse by using those weight-bearing joints.
Yeah.
So
And it can usually be, correct me if I'm wrong, it's usually like worse at night.
yeah.
Right? Yeah. And on examination, if you're going into OSCEs or something like that, internal rotation is usually restricted and
Would
painful.
be quite painful. Yeah.
So,
yeah.
For those who don't know what internal rotation is, it's whenever
You're-
it comes
you're
in
bringing-
internally,
yeah.
bringing in the joint mid to midline.
Yeah.
So yeah,
Or if you have your hip, I'm not gonna throw my leg up that high.
see that always confuses me. The hip internal rotation's like the opposite way.
Yeah, it's
'Cause you're-
the opposite way of where the foot goes.
Yeah.
Basically.
Yeah.
Um,
So
You guys can look up OSCE videos of hip examinations, and I ain't getting my leg up that high, so we're not.
Chris is not flexible enough.
No, not flexible enough. I've got a sore shoulder and a sore hip today, actually. To be
fair. Jiu-jitsu, man.
Yeah, it's killing me, man.
Killing you.
Yeah, that's right.
So we also talk about joint swelling, and stiffness.
They're your primary symptoms you'll come across with any arthritis, really. It doesn't have to be osteo or rheumatoid. It can be either. It'll have those joint swelling and the redness as well of joints. But typically with osteoarthritis, it's when you haven't, it'll be fine when you first wake up, but as the day goes on, you use those weight-bearing joints more, you rest for a longer period of time, you start to get that swelling and your pain and stiffness building up, which is in stark contrast to the rheumatoid arthritis, but we'll come to that. After we're finished with the osteo stuff.
And so your sort of generalized osteoarthritis, like your primary osteoarthritis, it usually affects certain joints, like Chris already mentioned. So that's like your weight-bearing joints, and more specifically, like if you're going in the hands, your DIP joints, and your thumb carpo
metacarpal joints. Yeah.
This one here, right?
This one.
Hey, that one there.
That one.
I'm quite weak in my anatomy.
So DIPs, distal interphalangeals, all these wee ones. Where I actually kind of have a bit of a
stiffness, do you know?
Yeah.
And
I'm getting old.
And the knees.
So you also can get certain other signs. So we've already talked about the tenderness, the swelling, but you can get what's called Heberden's nodes and Bouchard's nodes, which are wee sort of, bulbous lumps on. So for Heberden's nodes, they're on the DIPs. So you'll see them, if you look up Heberden's nodes, they'll be on the sort of DIPs, and there'll be a tiny little sort of bump.
Yeah.
And then with the is it Bouchards or Bouchards?
I call them Bouchards. Don't know why. It's the only way it sticks in my head. So Bouchards nerds. Bouchard.
They're on the PIP, so your proximal interphalangeal joints, which is those ones there. But yeah, it's
Bouchards. So
for goodness sake,
I'll insert an image here.
Yeah.
So just to showcase both
Heberden's and Bouchards node, but no, I'm gonna say like
Bouchards.
Jeez, come on, man.
So OA, Heberden's and Bouchards.
So moving on to the tests. So you would do a plain X-ray if anyone's got these sort of joint problems, and easy way to remember the things you'll see is LOSS. LOSS. Wow, that was really in sync. Go us. Yeah.
Right. So L stands for loss of joint space.
Self-explanatory. You'll look at the joint space of the bones there, and they will be decreased compared to what's normal.
And O stands for osteophytes, which are these bony projections, and it is mainly associated with degeneration of the bone.
Yeah. So you'll see these tiny little white specks kind of sitting away from the bone.
Yeah.
Next one is
I can get an X-ray up here so we can just point and talk about it.
But we don't know where we could be loss of joint space, and the flipping X-rays over here. We're just pointing at nothing,
Yeah.
Look it up yourselves. So the first S is your subarticular sclerosis, which when you look at the X-ray, you'll see these kind of lines on the bone.
Yeah.
I want to say they're perpendicular to the joint space. So if it's, if the joint space is like this, the lines will be going vertically up the way or down the way.
Sure, I'll buy it.
Aye.
So subarticular sclerosis and subchondral cysts
is the second one. Yeah.
Is the S.
So there'll be actual cysts that are you'll see on the X-ray. But yeah, so that's your main tests there, and then also with osteoarthritis, CRP may also be elevated if there's a bit of synovitis, inflammation of the synovial.
Now for the juicy stuff, Chris, the management what is the management for
what doctors
osteo-
should be doing, managing and treating patients
patients
the
with
real
osteoarthritis?
the real juicy parts.
Yeah.
So, first, as always, you start with your non-pharmacological treatments, which is, you recommend exercise to improve the surrounding muscle strength. If you've got a bad hip bone, building the muscle around it's going to sort of help. The same with general aerobic fitness. You improve your fitness, it's going to make that sort of hip problem less debilitating in a way.
Fitness is key.
Yeah, and
for
then,
everything.
yeah,
Really.
and then with continuing on with that, if the patient's overweight, always good to recommend weight loss as well. If there's more weight to you, that's going to put more pressure on those joints.
Yeah.
So that's your non-pharmacological start. Then you can go, if there's a mild sort of form of the condition, you can go through your regular pain management, so your paracetamol or your topical NSAIDs, so your like ibuprofen gels and stuff like that.
Yeah.
And then you can add codeine
Or short-term NSAIDs if it's to
if
it's
it
resistant.
requires it. Yeah.
Yeah,
And then
like
always make sure you recommend
cover it with PPI.
Yeah, a
'Cause,
proton
like,
pump inhibitor, just to make sure you don't get those ulcers.
They're bad, aren't they?
And heartburn, stuff like
Yeah.
that. My heartburn's gone away, actually. I don't think I have an ulcer.
I think. Oh, okay. So
Yeah.
it wasn't ulcer. Chris was
Typical
messaging me
medical
the other
student,
day.
I was diagnosing myself with a condition that I probably didn't have.
Probably didn't have. Yeah.
I
And
had
was
COVID.
laughing.
I had COVID recently, so I was popping,
Pills.
pills to keep alive. I
yeah.
suddenly got heartburn at the end of it. Anyway,
Back to the topic. So you can also use intra-articular injections.
yeah.
Which is steroid injections, obviously. But
Yeah. So that's just injecting straight into that joint and reducing that
inflammation.
Yeah.
And there are expensive type of injections, which are the hyaluronic acid
I'm glad
injections.
you went to pronounce that, because I was not going to be able to.
And these are all intra-articular.
Yeah.
But usually hospitals go with steroid injections.
Yeah,
Because the other ones are like
very
really
yeah.
expensive.
And then finally, you can
Your
go
final
to your surgery, so joint replacement. Everyone's heard of hip and knee replacements.
Yeah.
And they are the best way to deal with this severe types of osteoarthritis.
Yeah.
It just so happens that it is a surgery, so that comes with your own risks.
Yeah.
In that regard.
That's a quick summary on osteoarthritis. If you've enjoyed that, you can like and subscribe.
Yeah. So moving on to our rheumatoid then, are we? Or are we just gonna?
Rheumatoid will be covered in the next video, so
class.
feel free to look out for that one.
Unreal. See yous, guys. Peace.